Hi, this is Dr. Kahl Goldfarb with Water and Sports Physical Therapy. We're here today at one of our 6 locations in San Diego, California, and we're going to talk about thoracic outlet syndrome. So for those of you who have pain down the arm, numbness or tingling, into the hand, and even sometimes the possibility of having a feeling of very thick, swollen hand, could possibly turn blue, or just radiating pain into the arm, one possibility is that you have what's called thoracic outlet syndrome. We're going to talk about what it is and some simple techniques to try to help with that. First of all, your symptoms usually start in the neck and usually radiate down through the arm into the hand. I'll show you on Jennifer here the 3 areas that are usually implicated for this type of problem. So if you look in the neck, you'll see you have the muscles in the front here. Underneath the skin, obviously, you have the scalene muscles. You have a middle scalene, you have an anterior scalene. Those are just 2 muscles that come across like this. And basically you have the nerves and arteries, so we'll call the brachial plexus, which is a group of nerves and arteries that run out between them. Sometimes these muscles are tight, and when they get pushed together, they can squeeze the neurovascular bundle called the brachial plexus. If those get squeezed through here, you can have a decrease in the amount of blood flow in the arm. You can also have a decrease in the nerve conduction velocity. You can have an irritation of the nerve, and it can cause symptoms down into your arm and hand. If that's the case, sometimes, now I want to keep in mind here, we're giving generalities. Often if you stretch these muscles, which I'm going to teach you how to stretch, it'll increase your symptoms. It's always best to see a medical professional to make sure that you're treating A, the right thing, and B, treating it correctly. If stretching is indicated, what you would do to stretch the scalenes is to hold the shoulder down. You can hold it down with your arm like this, you can sit on your hand like this, or you can take a towel and try to hold one in front. You can do that way, and actually let's go here. Grab here like this, behind here, hold here, pull this down, and then side bend your head to the side. You can go this way for middle scalene. You can turn your head slightly back and you'll feel a little more anterior scalene. That is the first entrapment site of most nerves when they come out of the cervical spine, of the neck. The next entrapment site is the first rib. I'm not going to teach a first rib mobilization because I think it's important to make sure that's a problem first. But a practitioner who's skilled can mobilize or thrust the first rib down to give you more space and more room there, and it can be very effective in this treatment. The third area that usually is an issue is the pec minor. The pec minor is a small muscle that attaches to a bone in front here, attaches to the front of the scapular shoulder blade, and then goes across to the ribs. So basically this muscle here compresses down into the nerves and arteries and can cause pressure down in through the arm. Same type of symptoms. So in order to stretch that, I'll have Jen stand up. We'll go against a wall. You can go in a doorway as well. And you put your hand back. Now, if you put it really high, it stretches the pectoralis major, which we want to avoid because it's not the problem. We bring the arm down low here, or even lower here, and then you just slightly turn the body away. When you turn the body away, you're going to get an extra pull. Now keep in mind, if you do this, is a good possibility that you can increase the tension on those nerves and arteries and increase your symptoms. You never want to increase your symptoms in your arm because you're only causing further irritation to the blood vessels or the nerves. The last thing I want to keep in mind, which is probably the most important, which can almost help anybody with a problem that comes from the neck or thoracic outlet, is working on your shoulder blade squeezes. So basically what you want to do is focus on squeezing the shoulder blades. You want to emphasize the lower trapezius muscles, the muscles that are in the lower part of the shoulder blades, and think of these squeezing down and in. So if you pull the shoulder blades down and in, what are you doing? You're pulling on the muscles in the neck, the scalenes. As you pull down and in, you're pulling on the pec minor. So this is an active exercise to strengthen the scapular muscles and at the same time stretch the muscles that you need to decrease the pressure on the neurovascular bundle. So again, keep in mind, pain down the arm does not necessarily mean that you have thoracic outlet syndrome. You should get evaluated by a physician or a qualified doctor of physical therapy to make sure that's your problem before you start an exercise routine like this. If you have any questions, feel free to visit us at waterandsportsphysicaltherapy.com.